Women in the 1950s and 1960s had an average of around 50 to 100 menstrual cycles in their whole lifetime, whereas today women have an average of around 400 menstrual cycles. Hi, my name is Dr. Surakshith Battina. I'm an endoscopic surgeon and a fertility specialist working at Indigo Women's Center, Chennai. And in today's video, I'm going to give you all a brief overview about contraception, when and where to use them, what are the pros and cons of the various contraceptive methods, and what would be the right contraception for you. Contraception not only helps the women from reducing or not having unwanted pregnancies, but it also helps the women from the burdens of having too many menstrual cycles. Contraception in women can be classified as 5 parts. We have the barrier methods, we have the intrauterine devices, we have the hormonal methods, then we have the permanent methods of sterilization and the natural methods of contraception. The barrier methods of female contraception include the sponge, the cup, the diaphragm, and the female condom. Some of the lesser known ones like the gels, foams, and the creams are much lesser used. All or most of these compounds can have nonoxynol 9, which is an effective spermicide and can help in preventing pregnancy even more. Some of the pros of using these barrier methods of contraception include that 1. Few of these devices can prevent STDs. 2. It is absolutely easy to use, and 3. They do not have any side effects. Coming to the cons, they have a 20 to 30% failure rate. So that is the reason why barrier methods of contraception are always coupled along with the natural methods of contraception, which I will be detailing to you next. And the other con of this is that some of them say that it causes a little bit of discomfort during sexual intercourse. Coming to the next method of contraception, they are probably the most popular ones out of all of them, which is the hormonal methods of contraception. I will not really be able to cover this whole topic in this particular video. Do let me know in the comments down below so that I can make another video just on these hormonal methods of contraception. Hormonal contraception works by preventing ovulation. So that is in simple terms how they work. There are several generations of hormonal contraceptive pills. We have from the first generation to the fourth generation. Please do not get discouraged by only using one type of contraceptive method. Definitely go and try different combinations, different brands, and because one pill never fits all. Coming to some of the pros of using the pill, there is no delay of fertility for the patient after she stops the pill. The second advantage is that other than the contraceptive effects, the pill can also help the patient in reducing acne, to help patients who have polycystic ovarian disease, reducing the hirsutism. It can also help the patients who are having premenstrual syndrome and dysfunctional uterine bleeding. Coming to some of the cons of using the hormonal contraceptive pills, they require you to undergo a strict adherence for 21 days. So you need to continuously take the pill. Some of them are 21 days and some of them are 28 days. A few patients can suffer from nausea, vomiting, dizziness, and if the patient has migraine, we usually do not give these patients oral contraceptive pills. Patients are also having estrogen tumors and patients who are smokers, we definitely ask them not to take contraceptive pills. There is definitely a failure rate, but although it is much lesser than the barrier methods, the failure rate is somewhere between 1 to 8%. The next method of hormonal contraception include the dermal patches. These patches need to be only changed once in every 3 weeks, but they are not very popular amongst women because wherever you place these dermal patches, they form small whitish patches and cosmetically it does not look very appealing. The other method of hormonal contraception include the Implanon, also known as the subcutaneous dermal implant, and these implants are absolutely effective and they last for 3 years. The only challenge with this kind of implant is that it requires a small surgical procedure to place the implant inside, and also requires a small surgical procedure under local anesthesia to remove the implant. Coming to the next set of contraceptive methods, we call them as the intrauterine devices, and these devices can be either hormonal or non-hormonal. The non-hormonal ones include the multi-load or copper T. So what these devices do is that they form a foreign body reaction inside the uterus. So whenever there is a foreign body inside the uterus, it is detrimental for the implantation of either the embryo or the detrimental to the sperm. So these devices can be inside the uterus for a very long time and they need to be only replaced once in every 10 years. The hormonal intrauterine device, also known as the levonorgestrel IUCD, works just like any of the hormonal pills, like they prevent the ovulation from occurring. They also have all the other benefits of using the hormonal methods of contraception for women, and more importantly, these also have a long-term period of use. They should be replaced only once in every 5 years. Some of them are also replaced once in every 10 years. Some of the major cons of using intrauterine device is that one, they can get expelled from the uterus during menstruation, and two, that some of them can get lost inside the uterus. So when they get lost, we need to do a hysteroscopic procedure to retrieve these intrauterine devices out. Another quick mention I would like to do is about the Plan B, or also known as the emergency contraceptive pill. I would not recommend anyone to use this because it is not an abortifacient, but instead how it helps is that it prevents the LH surge from happening. So it is a combination of ulipristal, levonorgestrel and misoprostol, and it should be taken immediately within 24 hours to 72 hours of sexual intercourse. Coming to the natural methods of contraception, these always have to be combined with the barrier method of contraception because they have a failure rate of somewhere between 50 to 60%. Usually how this works is by having a look at your basal body temperature, by trying to avoid having sexual intercourse from the 7th day to the 16th day of the menstrual cycle, by the pull-out method, basically the penis is pulled out just before ejaculation, and finally by checking the urine levels of LH. The last and final type of sterilization is the permanent method of sterilization, which basically is divided into puerperal sterilization and the interval sterilization. Puerperal sterilization is a sterilization which is performed during the cesarean section, and during this procedure the tubes are also tied, so basically we are combining two procedures in one. Whereas the interval sterilization is performed 6 months after the patient's delivery, and this procedure is done by laparoscopy. It is a daycare procedure. The patient comes in the morning, she leaves by afternoon. Although these are considered as permanent methods of sterilization, there are ways of tubal reversal which can be achieved laparoscopically. I will be linking the procedure out here. You just have to click on this card and it will take you directly to the procedure video. Assure is a type of permanent sterilization which does not require any laparoscopic approach. This procedure can be done completely via the hysteroscope. So I hope you got some value out of this. If you did, go ahead and leave a thumbs up, leave a like for this video, and for more such informative talks you can go ahead and subscribe to my YouTube channel. Make sure you follow me on Instagram. I'm going to link it out here, and until the next one guys, see you and have a great day.